Hi, I am Dr. Seema Sharma from Srishti Femcare, and today we would talk about menopause. So, what is menopause and when is a woman likely to achieve menopause? So, if you look at the name, menopause means there is a pause in the menstruation pattern of a woman. Menstruation is the monthly periods, monthly bleeding a woman has, and when this monthly bleeding stops, we call it a menopause. Now, it can happen naturally. Most common age is between 45 to 55, and in our country, an average age is around 50 and a half years. And during this time, a woman's monthly bleeding would stop. But monthly bleeding can also stop if you have had your uterus removed, you've had a hysterectomy, you've had any kind of surgery on your ovaries, because of which the hormonal production has gone down. So, for any reason, when your body stops to produce its estrogen, and the periods stop either as natural or as a result of surgery, we call it a menopause. So, besides the stoppage of periods, what else can happen? How else do you know? Because there are a lot of women who have their uteruses removed in their young age, but their ovaries are functional. That means their bodies are receiving enough estrogen. So it is not yet menopause for them because inside our body they have enough estrogen. They may not be having their monthly bleed. So once menopause is achieved, means a woman has had no periods for at least 1 year, no visible bleeding at least for 1 year, and it could also be associated with certain other symptoms. And it is said that almost 50% of women, that means 1 out of 2, would have some kind of symptoms during these menopausal years. The symptoms can be the most common is hot flushes. A woman feels very hot. Suddenly she has like anxiety, and then there are waves of heat coming through the face. She wants to move to open the doors. I want to go to a cooler environment. So hot flushes, it can happen any time of the day, then day or night or while sleeping, anytime. The vagina gets very less lubrication. There is low mood. There are aches and pains everywhere. The woman tends to get very depressed for no reason. A lot of time we see women coming to me and then they say, doctor, I have no problem as such in my life, but I'm still feeling very low, very disheartened, and I feel like crying. So these can be symptoms of menopause. The patients have less interest in sex. The vagina is very dry. You generally feel that there is no lubrication in your vagina. So some women would want to go through menopause naturally, while the other end of spectrum faces very hard menopause. For those other spectrum, we need to give them treatment, and treatment is available with the doctors. So if you feel that you are more than 45 and you're like in that range where the menopause has been around the corner, and you are facing difficulties in the common symptoms that I have just mentioned, it is best to talk to your gynecologist and have yourself examined. Also, if your periods stop before 40 years of age, we call it a premature menopause. Now, that is a situation which can be harmful for your body, and we usually recommend some kind of supplements for your bones, some kind of supplements, because your heart may be at risk, your bones may be at risk. The estrogen has stopped prematurely. There is a reason, these kind of women have a lot of backaches, a lot of knee issues. So they need to take some hormonal supplements to safeguard their bodies. So if you are one of them wherein the periods have stopped before you have been 40, we call it premature ovarian menopause, premature ovarian failure, when it happens before 30. So there are a lot of terminologies, but if you're listening to this video and you feel there could be a problem with your periods, with your symptoms, with your mood, it is best to come and talk to your gynecologist or your primary care physician so that you can avail of help. We'll come back later with more. Thank you so much.